The Minister of Health and Addiction, Yara Saks, says that her government's radical decriminalization of illicit drugs policy isn't to blame for increases in overdose deaths in British Columbia, as funding for drug users and the advocates that enable them continues unabated.
There's certainly the perception by a lot of Canadians that a lot of downtown cores are basically out of control. And certainly there's also the perception that around places like safe supply, safe injection sites, that things are worse, that there are people openly stoned in the street, people are getting CPR performed on them in the street, there's needles around in the street, there's excrement in the street.
In a briefing note, the Federal Minister of Addictions and Mental Health, that's Yara Saks, said that it's inaccurate to claim that decriminalization of cocaine and opioids are the cause for a 16.5% increase in overdose deaths in British Columbia since last year, as first reported by Blacklocks. On February 1st, 2023, the federal government gave the province of British Columbia a pilot project exemption under the Controlled Drugs and Substances Act in a failed attempt to quell the province's drug emergency, first declared in 2016.
The drugs on the streets are getting stronger, and what that does to cognitive capacity. If there's brain damage involved, people may recover from their addiction, hopefully, but then now they have these comorbid cognitive deficits that, how do you navigate that? But to flip all those policies inside out, so funding was more contingent on how many people that got housed or how many people that went back to school or returned home. If the dollars were attached to incentives that had a different outcome, we could probably pivot some of the outcomes that we're seeing.
It has been 8 years and the crisis rages on. Overdose deaths surged to 3,313 in the first 15 months following that pilot project, up from 2,843 in the previous 15-month period. That alarming 16.5% increase directly correlates with the nonsensical decriminalization efforts. This comes as British Columbia's addiction minister rejected the province's medical officer of health, Bonnie Henry's recommendations for a radical call to expand the safer supply program and allow people to obtain opioids without a prescription, including at compassion clubs and retail stores. This is the same province that the feds gave a majority of $3.5 million for 5 opioid dispensing vending machines, 2 of which are in Vancouver, 1 is in Victoria, and 1 each in Nova Scotia and Ontario. These machines, called MySafe, are similar to ATMs and allow drug users to get hydromorphone pills, a substitute for heroin, dispensed to them after their palm has been scanned to identify them.
There are published case reports in the literature of people dying of overdose from accidental administration of 3 milligrams of hydromorphone in a hospital setting. There are multiple cases of that, and that's why it's a high-risk medication and why we go to so much effort to label things morphine versus hydromorphone. Hydromorphone is extremely potent and could kill a person with no trouble if they don't have opioid tolerance. When we look at fentanyl, which is 50 times more potent than morphine, and then you look at the number of grams that a person could hold, that certainly is an amount that could easily kill 1 or more people.
The community-based compassion clubs that Henry wants to legitimize includes DULF, that's the Drug User Liberation Fund, whose co-founders Jeremy Callicum and Eris Nix were arrested last October, charged with 3 counts each of possession for the purpose of drug trafficking. According to the DULF website, they were operating these compassion clubs and fulfillment centers as a groundbreaking initiative and research endeavor dedicated to combating escalating overdose deaths in Vancouver's downtown east side. The first of its kind pioneering model operated as a non-profit, low-barrier, and non-medicalized approach to regulating the vitality of the content of the illicit drug market that built upon existing overdose prevention strategies by providing supervised consumption services, but also offered rigorously tested cocaine, heroin, and methamphetamine at cost to users of these substances. According to a 2023 article in The Economist, the pair hoped that DULF will emulate that path, a criminal enterprise one day and a public health success the next. They ran one of their first drug trafficking operations in the summer of 2021, where they gave away free drugs in a police station car park with the City of Vancouver councillor Jean Swanson. This included as mentioned, meth, heroin, and cocaine. The article at that time further noted that Dolph was being funded by the Regional Health Authority, which is the BC Ministry of Health, as an overdose prevention site and by the Centre on Substance Use as a research project. Another entity, the University of Victoria, tests its substances. According to public accounts for 2022 and 2023 for substance use and addictions programs, the University of Victoria received over $2.7 million, received an additional $20 million for grants and scholarships, and another $7.6 for grants and scholarships, and just over $7 million in research support funding, and tens to hundreds of thousands of other payments annually from the feds. With taxpayers footing the bill every which way, the drug crisis goes from funding the actual drugs and the supplies to funding the strain on resources plaguing communities all across Canada, and then suffering from the residual public safety fallout of all of it. This marks a failure not only in the policies themselves, but also a failure in accountability and both social and fiscal responsibility. For Rebel News, I'm Tamara Ugolini. We've launched a campaign at fixourcities.com where you can find all of our reports on this topic because it's clear that this issue is growing and it's out of control. Head on over to fixourcities.com, help support our work, and sign up so you never miss an update. Thanks for your help.